Good day, everyone. Welcome to Mindful Monday, and thank you for tuning in. Last week, we started with the following theme. What is the difference between anxiety and depression, and how will I know if I have one? Due to the magnitude of this theme, I suggested that we do this in two parts. So last week we focused a bit on anxiety, and today we will be focusing on depression. Due to the fact that this is a very huge topic and there's so many facets of it, I thought it best that we could maybe just discuss what exactly depression is and what the symptoms of it is. And then during the rest of the week on my Facebook page, we will be exploring depression a bit further and maybe look at a few ways that you can manage it and that you can manage it through self-help options during the rest of the week. Now, first of all, and I've mentioned this on various occasions on this channel, I have to remind you again that I am not a clinical psychologist. I am a social worker and I am also working in the mental health field and with mental health professionals as well. I also do medical social work and psychiatric social work, and therefore I work and do therapy with a lot of these patients. So without any further ado, let's start off then and delve a bit into depression for today's topic. So what is depression then? If you have followed my series, I have previously discussed depression in children, which is quite similar to this topic, but there is some aspects which also differ. So depression is very different from just feeling sad or blue. A lot of people do not believe in depression. There is a lot of myths, a lot of stigmas which goes with depression. But depression is a formal mood disorder and it has to be diagnosed to actually be acknowledged. So you can't just go around and tell people you have depression just because you are feeling a bit sad because of something that has happened. If you have not been formally diagnosed with depression, you do not have depression and you cannot say that. So depression is an extreme sadness or despair which lasts for 2 weeks or longer than that. And the sadness or despair is so bad that it actually causes physical and emotional symptoms in you. And this symptoms interferes with your daily functioning. So you cannot do what you normally did or function optimally because you have these symptoms. And these symptoms is not a result of substance abuse, of substances or alcohol that you are taking, and it's also not a result of any medical condition that you are experiencing. And that is in a nutshell about the best description of depression that I can give you. So it's not something like just get out of bed or put on some makeup and you'll start feeling better. Something totally different than that, and it has to be diagnosed. So then what is the symptoms of depression? The symptoms is that you have a depressive mood for most of the day, nearly every single day. So it doesn't get better, you feel that way nearly always. You have a diminished interest or pleasure in activities. You do not enjoy the things that you used to enjoy. Some people lose a lot of weight without dieting or doing anything, or some people gain a lot of weight without doing anything because sometimes there tend to be a change in your appetite. You want to eat the whole time or you don't want to eat at all. It seems, or people describe it like they're slowing down of thoughts. They can't think like they human or normally previously thought. It's like there's a vagueness. So they struggle to think as effectively as they always did. And there's also a reduction in physical movement. Other people can see it. The person who's feeling depressed cannot always see it, but other people can see that you are not moving or doing as much as you previously did. Then you always feel tired. You cannot do anything. You don't have energy to do anything. You just want to lie down and rest because physically you do not have energy to do anything. You feel worthless or you have excessive feelings of guilt. So we always talk about the circle of depression as well. You don't do anything because you don't have energy for anything, and then you feel guilty about it. And because you feel guilty, you don't do anything. So you hear the cycle here. There's also, like I previously mentioned, a diminished ability to think or concentrate. You cannot seem to make any decisions. You don't know what you want to do. You can't do anything. And this is nearly every day. It continues. It's the same. And then eventually this person has recurrent thoughts of death and of suicide. We call it suicidal ideations. We see a lot of suicide attempts also in people who struggle with depression. So you see a lot of these symptoms when you actually think about it. You can definitely see that it's more than just feeling sad. That's why when people compare sadness and depression with each other, there really isn't any comparison between the two. Because the one is the illness and the other one is just the emotion. So be very careful when you have someone who is depressed, not to diminish that illness just to an emotion. So if you have recognized any of these symptoms or feelings in yourself or someone else, maybe consider following some of the self-care advice which I'll be giving on my Facebook page during the week. Or maybe consider getting some professional assistance. There's lots of tests that we can do to determine whether you are depressive or not, whether you have these symptoms or not. There's also a lot of consultations and in therapeutic assessments that can be done to determine this. And again, like with the anxiety that we've discussed, there is various ways to treat depression. So if you've recognized this, maybe it is time to start doing something about it. No one deserves to be feeling this way. So good luck, follow my page, subscribe to the YouTube channel, and then I'll see you next week. Have a good week.